The Connecticut Department of Public Health created a toolkit called the Nutrition and Oral Health Screening Toolkit for dental providers. The goal of this toolkit is to provide dental professionals with resources and tools to address common modifiable risk factors for tooth decay and childhood obesity by developing a systematic approach to identify at-risk pediatric patients. This toolkit includes information to help dental providers discuss the importance of good oral hygiene and healthy nutrition habits with their patients, and encourage behavior change by using motivational interviewing skills. This video will walk you through how to use the toolkit. Dental caries and childhood obesity are two of the most common health issues that can occur during childhood, and both are influenced by common modifiable risk factors. Dental providers have a unique opportunity to systematically screen pediatric patients for these risk factors and aid them in making simple, sustainable changes to improve health outcomes throughout the life course. The first step in doing so is through motivational interviewing. Motivational interviewing, also known as MI, is a style of communication that helps address hesitation or doubt about change. It works to strengthen personal motivation for and commitment to a specific goal by helping a person better understand their goals and reasons for change. MI relies on compassion and acceptance to be successful. Dental providers can use MI skills and techniques to engage patients or parents in a discussion on the importance of good nutrition for their oral health. Dental providers can refer to the motivational interviewing tip sheet for guidance. The next step in learning more about a patient's health and risk factors includes completing the nutrition and oral health assessment. Before starting this, however, your patient's BMI must be collected. This can be a good opportunity to explain the importance of nutrition and oral health. You can say something like, "I would like to discuss the importance of good oral hygiene and healthy eating habits. The first step is to take you or your child's height and weight, and then I would like to ask some questions about you or your child's diet. Is this okay with you?" It is also important to mention that the assessment is for patients 1 to 18 years old, and screening should occur annually. While 1-year-olds can participate, BMI is not required. To measure a patient's height, start by determining if they're able to stand without needing help. They should remove any heavy clothing and shoes. If a child cannot stand without help, you can find their height by using a tape measure to measure the length of the child. Have them lie flat and straight in a fully extended dental chair. A parent or assistant should hold their head. Measure from the crown of the head to the bottom of the heel. To measure the child's weight, determine if they can stand on a scale without help. If they can't, the parent or guardian will step on the scale while holding the child. Next, have the parent or guardian stand alone on the scale. Then, calculate the weight by subtracting the parent or guardian's weight from the total weight to determine the patient's weight. Finally, to assess the BMI, refer to a BMI table. Once BMI is determined, the next step is to complete the Nutrition and Oral Health Assessment. Page 1 begins with the Caries Risk Assessment, otherwise known as the CRA. Assess your patient based on the 10 categories and score accordingly. Total up the points, enter the corresponding billing code, and add in any additional notes or observations if you have any. To be able to bill for the CRA, dental providers must receive CRA training by the Connecticut Dental Health Partnership. For more information on the CRA training and billing, please contact the Connecticut Dental Health Partnership at 855-CT-DENTAL. Next is the Nutritional Questionnaire, located on page 2 of the Nutrition and Oral Health Assessment. Start by entering the patient's BMI, then enter their CRA score from page 1. Complete the 5 nutritional necessity screening questions. If a patient is yes to medical necessity questions 1 or 2, and yes to any of the nutritional necessity questions, then they are at risk. If a patient is yes to medical necessity questions 1 or 2, and no to all of the nutritional necessity questions, then they are at risk. If a patient is no to medical necessity questions 1 and 2, they are not at risk, regardless of their responses to the nutritional necessity questions. If a patient is at risk, a few things will happen next. The dental provider will conduct in-chair counseling, refer the patient to primary care or nutrition services, complete the patient goal-setting document with the patient and/or parent or guardian, follow up at the next 6-month appointment, and finally, re-screen annually. A patient goal-setting document is included in the toolkit and provides recommended goals, but goals can be tailored to each patient's needs. If a patient is not at risk, the next steps include in-chair counseling and re-screening annually. Completing the patient goal-setting document and following up at the next 6-month appointment is optional. The toolkit includes several other resources that can support your patient's oral health and nutritional health. The patient education handout provides patients with age-appropriate nutrition and eating habit recommendations. A poster is also included in the toolkit to convey the importance of oral health and a healthy weight. The final two documents are the Dental to Medical Referral Form and the Medical to Dental Referral Form. These documents can be used to refer patients to either a primary care doctor or a dentist. This referral is based on the results of the Nutrition and Oral Health Assessment. Thank you for your interest in the Nutrition and Oral Health Screening Toolkit for dental providers. We hope you will find the toolkit to be a valuable resource in making a positive difference in the lives of your patients. This video was brought to you by the Connecticut Department of Public Health.